The reports that came out of China says that you never really get rid of the coronavirus. Now, they'll say people have recovered, but technically they didn't recover at all. They still have traces of the virus in their system. The Pope is sick, and they said he visited people that were quote unquote recovered from the coronavirus. This should tell y'all, even if a person is not showing symptoms, they still have this virus. I think what China said in this instance is true. And now you're seeing this all over again now in the state of Texas. Wuhan evacuee was released from quarantine in Texas and later tested positive for the coronavirus. What I think happens, y'all, is once they're in quarantine and they're able to, you know, no longer feel any of the symptoms, in their minds they recovered, but in my mind I think it's still there, but the symptoms are just so minimal that it does not show up on the test. And this is why many are saying the testing that they're using is inadequate. It is not detecting the coronavirus in people that really have it, but they're not feeling the symptoms. So this person was in quarantine in San Antonio and they were released by the CDC back into the public. I don't think these people should come back in the public. And if you are going to release them, they should be under some type of house quarantine and not be around a bunch of people. I mean, I'm sure they can come up with something, but just throwing them back out in the public and you don't know enough about this virus is a fatal mistake. So, since this person went around San Antonio, how many people did they have contact with? When they were released, just think about this. They probably went shopping, especially if they just came back from Wuhan. They went shopping, probably was around family members, friends, interacting with people just in general around them, neighbors, people that they're familiar with. So now this one individual probably infected others by now. So they were being held at Lackland Air Force Base in San Antonio, Texas, when they came back from being in Wuhan, China. So the mayor is upset, and I don't blame them. And they said, the CDC released this person and allowed the public to be exposed to the coronavirus. They're in San Antonio, and they're saying it is absolutely unacceptable. And I agree with that. So the bottom line is the CDC needs to do, a better job in detecting the virus and then a better job in quarantining these folks. Now, the mayor is saying, and I agree, that these folks should be quarantined a lot longer than they are. They're being released way too soon. So, but what the CDC did before they released this person, they tested them twice. The test came back negative twice. And then they tested the same person a little later again, and they came back positive. So, what I'm saying, ladies and gentlemen, I don't believe they were ever negative. I think the test just couldn't pick up the coronavirus still in their system. And I wonder what made the CDC go back and test this person one more time, a third time. And then the test showed they were positive. It doesn't say what made them go back and test this person again, but they did. So, um, so they're saying, do they need to perform additional tests? before letting these people go, yeah, they need to do a lot more than what they're doing now. Absolutely. So the mayor sent out a tweet very upset with the CDC and putting the accountability on the CDC for this person exposing people out in the public of the coronavirus from this one individual they had released. So they're pretty much saying the CDC exposing the public in San Antonio is unacceptable. However, the individual is not showing any symptoms according to local officials. So the person is testing positive, y'all, and they're not showing any symptoms. I wish they would have said in the article why they went back and tested this person a third time after they released him, but they're not saying why. Okay, so we hold the CDC accountable to providing complete transparency for the public. This situation is exactly what we have been asking for federal officials to accept the guidance of our medical community. As a federal quarantine period for Americans evacuated from the Diamond Princess cruise ship comes to an end Monday. So they're saying as of Monday, anybody that they took off of the cruise ship, they're letting them go. They're letting those people go. Now, here in my state, 3 people were on that cruise ship and they tested positive. But it's amazing if you go out and look in New Jersey coronavirus, it'll tell you that nobody here got the coronavirus, and that's false. 3 people do. And there's cases up in New York, Massachusetts, Rhode Island. And I pulled up an article this morning, Tampa Bay, down there in Florida, have 2 people that tested positive for the coronavirus. Y'all, within weeks, it's going to be people all up and down the East Coast with it. Make no mistake about it. Right now, they're saying most of the cases are on the West Coast, but trust me, the East Coast is is going to catch up real soon at the rate this thing is going. So the mayor, is expressing concerns. They're upset about the number of people that could have been infected down there in San Antonio. So San Antonio Metropolitan District spokeswoman Michelle Vigil said the person released by the CDC was one of 11 preemptive positive cases her department is monitoring. 9 of those people were evacuated from a cruise ship. 1 person was evacuated from Wuhan, and another was transferred from quarantine Miramar, California. All right. Diagnosing patients have been problematic. Yes. And that's been problematic, y'all, worldwide. The testing is very inadequate. I don't care what country you're in, it's inadequate. Early in the outbreak, the CDC issued guidance saying potential patients needed either to travel to China or have been in close contact with someone who visited in China before being tested. New criteria were issued after a patient from Northern California contracted the illness despite meeting neither prerequisite. So this person didn't come in contact with someone that traveled to China, and they don't know how they got it. So this person never left the US, but somehow they still got the virus and still can't pinpoint how they got it. This came 2 weeks after several states reported that some CDC test kits weren't working properly, forcing the center to remake parts of the test. Health experts also expressed concerns about the dearth of test kits. The federal government is working to bolster its testing capabilities, mailing more than 15,000 test kits to local and state labs over the weekend, Vice President Mike Pence said. Also, where there was only one CDC facility that could test for the virus in the early weeks of the outbreak. Health and Human Services Secretary Alex Azar said last week there are now dozens of labs capable of doing the test. Wow. Wow. As long as they don't get the testing part of it right, ladies and gentlemen, a lot of people are going to fly under the radar and be out here spreading this virus. Very easy. You can definitely see that happening. And I'm just telling you, I don't know how they're going to keep places open once this thing really spreads. You're going to have businesses that are going to have to close. Let me
South
just
Korea has
watch this video real fast.
Cases of coronavirus than any other country outside of mainland China. We're going to take a look at an innovative technique that the country has come up with for expediting trying to detect coronavirus infections. We're about to take a look at drive-through coronavirus testing. Coronavirus cases in Korea jumped from 31 to more than 4,200 in just the last 2 weeks. And thank you very much. Now, here's the thing about what the city is doing. It's offering free coronavirus testing to anybody who comes here. You don't even have to be a citizen, a resident of this city of Goyang. Temperature? I'm instructed to stay in the car the whole time. Okay. Yes, okay. I fill out a questionnaire to see whether I have any symptoms or if I'm in a higher risk category of people who have visited the city of Daegu, where more than 70% of Korea's coronavirus cases have been diagnosed. This is a tough job that the nurses have, and a volunteer doctor. They do 5-hour shifts. They can't go to the bathroom. They can't drink water. And, as one of them told me, it's cold here. Korea has tested more than 100,000 people since the outbreak began. This drive-through site can test. It'll be 2 to 3 days before I get the test results. I spoke with a doctor at a coronavirus crisis center, and he says that one of the best lessons that Korea has to offer other countries that are just beginning to deal with coronavirus are these drive-through test sites, because the authorities say you can process more people quicker, and it limits the exposure of the medical professionals themselves to patients who could be carrying the disease. Ivan Watson, CNN, in Goyang, South Korea.
So there you go, ladies and gentlemen. South Korea is doing all of this, and they still have a horrible amount of cases there. So you can see everything that they're doing is right now, it's in vain. They're still getting this virus, and it's nothing. It's almost like there's nothing they can do. But back to here in the US, unfortunately, they have not perfected the test good enough where it is picking up the coronavirus in people that are showing no symptoms, which means everybody right now is at risk until they're able to do this. And it's no telling if they're ever going to be able to do this, y'all. It's no telling. It's just like the flu shot. You can get a flu shot and still get the flu. We saw that in the previous years that I did on the flu deaths in this country. Some of these people, they got their shots. Children had their shots and still died. And they were like, well, it was because the flu that came out, the flu shot was of a different flu than the flu that was out in the public. So it's a hit or miss whether they get those flu shots right. And in many cases, they don't. So, I hear all this talk about vaccines. I don't know. How do you get a vaccine when you can't even get the testing part of it right? I mean, at this point, would you trust any vaccine that came from this place? I wouldn't. But y'all, please tell me what you think. This is just crazy. And I hope everybody down there in Texas is safe. But wow, they are doing a lot of stupid things when it comes down to this virus. Please leave your comment and subscribe. Don't forget to hit on the notification bell, and I'll see you on the next video. Peace, family.